Hi, I'm Chantel. I'm going to be your nurse today.
Hi, Chantal.
Okay, this is Colton. He is a 22-year-old male presenting today with a cough. Colton, can you tell me why you're here today?
Because I have a bad cough.
And how long have you had this cough?
For about a month.
And have you had any recent illnesses?
Yeah, I was sick about a month ago.
Can you describe your breathing today?
It's pretty good today.
Okay. And can you describe any changes in your breathing in the last 2 days?
Yeah. It's gotten a lot better since yesterday.
Were you having trouble breathing yesterday?
Yeah.
Were you short of breath?
No, I just had a bunch of mucus in my lungs.
Okay. And how long have you had this mucus?
For about a month.
And are you coughing anything up?
Yeah.
And what color is it?
Yellowish clear. Not real dark yellow.
Okay. And do you breathe through your nose or through your mouth?
Both. But mostly my mouth.
And is there a reason that you breathe through your mouth? Do you have trouble breathing through your nose?
Yeah, usually my nose is clogged up.
And how long has this been going on?
Since I was about 7.
And have you had any treatment for this?
Yeah, I had surgery.
And did the surgery help?
Yeah, it is a lot better than what it used to be.
Whenever you were saying you were having a little trouble breathing yesterday, was it worse whenever you were doing activities?
Yeah, that's the only time I really had trouble. It was just like wheezing from the mucus.
Were you able to still perform your activities that you needed to during the day?
Yep.
Or did it keep you from doing anything?
No, I could do whatever I needed to do still.
Okay. I need to inspect your chest, so
Okay.
if you could please take your sweatshirt off.
Okay, I'm gonna have a t-shirt.
Okay. Now I'm going to just feel your back. I'm just going to palpate it. So you will feel my fingers on your shoulders and then down your back. Can you take a nice deep breath for me? Can you say the number 99?
99.
And can you repeat it?
99.
Can you count to 3 for me?
1, 2, 3.
Now I'm just going to tap on your shoulders and then down your back. Okay?
Okay.
And I am going to listen to your back now.
Okay.
Can you take a couple of nice deep breaths for me? am going to inspect the front of your chest now, okay? Can you take a deep breath in for me? And can you say the number 99?
99.
And can you repeat it for me?
99.
Can you say 1, 2, 3?
1, 2, 3.
Okay. I'm just going to tap on your chest now. And I'm going to listen to your lungs from the front now. If you could just take a couple nice deep breaths for me. Colton, do you have any family history of respiratory illnesses?
Nope.
Do you have any history of respiratory illnesses?
I had asthma when I was a kid.
And you outgrew that as you
Yep.
got older? Did you have to take any medication when you were a child?
Yeah, when I was a baby.
Okay, and what kind of medications were they?
I don't know.
Are you a smoker?
Yes.
And how often do you smoke?
It's weird. Sometimes I don't smoke any cigarettes during the day. Sometimes I'll smoke a whole pack.
Okay, so on average, how much would you say you smoke per day or per week?
Maybe like a pack and a half a week.
Okay, and how long have you smoked?
Since I was probably 16.
Okay, and have you ever tried to quit?
Yeah, but not very hard.
And what did you do when you tried to quit? Did you use any medications,
No.
any patches?
No.
You just tried to quit cold turkey on your own,
Well, I chewed.
chewing tobacco?
Mm-hmm.
Okay, and how long have you used chewing tobacco?
Since I was probably 14.
And would you say that how often do you chew a can?
Maybe every 2 months.
Okay. And do you use any over-the-counter medications when you said you were sick about a month ago?
Yeah.
And did you use any over-the-counter medications?
Yeah.
Or were you prescribed any medications?
No, over the counter.
And did you feel that helped?
Yep.
Okay. Are you interested in any information on helping you quit smoking?
No. Yeah, I guess.
Okay. I'm going to get some pamphlets for you,
Okay.
and I'm going to give you some information.
Okay.
Okay.
Thank you.
Here's some information for you. Now, there's different ways that you can stop smoking. There's a patch. There is cigarette or the e-cigarettes. There is nicotine gum, and there is medication as well.
Mm-hmm.
Some people try to quit cold turkey, which that can work for some people, but a lot of times that has a lot of you have a lot of withdrawal symptoms, and people tend to go right back to smoking. Now, there are
Excuse
some.
me.
Yes.
Are you done with my cup of my shirt on?
Yes.
It's chilly in your office. Okay.
Some people try when they just stop smoking. They don't use any aids that we offer. such things as chewing gum instead, or eating hard candies, or because a lot of times the problem is that they are have a fascination with just the hand to mouth kind of motion. They always have to have something in their mouth.
That's
so,
all mine is, yeah.
Okay, so maybe
I just like to do it. When I quit, I don't do no withdrawal or nothing. I just
okay.
enjoy it.
So this is some information on the patches and the nicotine gum and different medications we have, but it sounds like maybe for you that we could just use like maybe a support system. I could give you some information to a hotline, so if there are any moments that you feel that you are going to have a relapse, you can call this number and you can get support too, so that you don't smoke.
Okay.
Now, like I said, you can do things such as hard candy. Some people do lollipops, chewing gum, anything to kind of keep something in your mouth to keep you from smoking the cigarettes. Are you interested in any of the information that on the pamphlets that I gave you, or
Yeah.
would you be
I'll read
interested
through.
in trying like the patch or medication or anything?
No, I don't think I need that.
Okay, so you're just interested, maybe I get you some information on like a support group, a 24/7 hotline.
No, probably just more like the hard candies and eating stuff like that.
Okay, well,
Maybe the support group.
I'll still give you the information just so you have it handy, and that way if you feel that you need to use it, you can, and then if you don't use it, then that's great, then maybe you don't need it.
Okay.
But sometimes it can be a little harder than you think.
Yeah, definitely, I agree.
Okay, so how about we make a goal? You say you smoke about a pack and a half a week.
Yeah.
How about we make a goal? I'd like to see you back in a month from now.
Okay.
And in a month from now, let's maybe see you, let's come up with a goal together that you would like to decrease your cigarette use to per week. So I'll see you 4 weeks from now. So over the next 4 weeks, let's decrease your use to maybe half a pack a week.
Okay.
And then we'll slowly work our way, and hopefully we get to the point where we're not smoking any cigarettes at all.
Yep.
Okay, so what are the ways that you can, some of the aids that you can use to help you quit smoking?
Hard candies, gum, jerky, lollipops. Maybe the hotline, I could call it.
Okay, and then if those don't work, what are some other ways that you can use?
Well, I could try the patches or the nicotine gum or those things also.
Okay. And then what's our goal for you in 1 month when I see you back?
To smoke about a half a pack or less a week.
Alright, and does that seem like a reasonable goal for you?
Yep.
Okay, wonderful. So it is very important. Smoking is really bad for your health. It higher your blood pressure. It can cause hypertension, lung cancer, heart disease. It puts you at very high risk for all of these. And you're also at high risk for a spontaneous pneumothorax. Now, this just means that
My lung collapses.
your lung can collapse, yes,
Yep.
spontaneously.
My mom has that.
Okay.
She had that happen twice.
Okay, so then you're at very high risk, because the people that are at high risk for that are young
Skinny people.
males, skinny people,
Yep.
And so, and if your mother has a history of that, then that also puts a very big heredity is also a very big risk factor.
Yeah.
So I definitely would like to follow up with you on this, and I hope that I can help you in your success for quitting. And I'd like to see you back in a month,
Okay.
so we can see how you're progressing and what we might need to do to go from there.
Alright.
Okay? It was very good to meet you, and I'll see you back in a month.
Alright. Sounds good. Thank you.